Are we start? Are we on?
Yeah, be recording.
Oh, okay. Good afternoon.
Mm-hmm.
Okay. Good day. If you're watching at night.
Good day.
Greetings. It's been much more neutral.
Mm.
Can you shut up?
Hello and greetings, everyone. Welcome to Hills Talks with Craig, Surprise, and Tom.
Tom in the background.
I wanted to rhyme Tom with talks. Yeah. And it's Mother's Day. There's Mother's Day, right?
Mother's
Woman-
Month.
Mother's Month. Mother's Month is coming, and we wanted to talk about moms. I'm a mother love. Well, let's talk about moms and being a mother and linking it to your oral health. And so that's what we'll be talking about. The very first thing that I want to get into is inflammation. That is the biggest complication I think I can think of. I'm not a gynecologist. Is it OBS?
Often guy.
Yes. Yeah.
But we're actually talking about like before you become a mother for the first time, or second, or third, or fourth, or fifth,
Yeah.
whichever you are on. Like what happens in gestation, pregnancy.
Wait, which part are we going into? Like what happens there, or like
What happens to you as the mother?
as the person
Yes, as the mother.
holistically?
I mean that's for a different speciality.
Okay.
Yeah.
Well, we're talking about like becoming a mother. We're talking about mother. I don't know anything about mother. I don't know if I can tell women anything about mother. I can tell you what will happen to your teeth. But anything beyond that, that's me trying to get cancelled or offend a whole bunch of women. Because I would say something, it's easy. Stop complaining. Just be a mom. I'm just kidding. But like, I don't know. What do you mean? Just expand on that.
So before you have a baby, you go through the cycle of gestation, commonly known as pregnancy. So there's a few changes that happen in your mouth before, like when you're pregnant.
Oh, so we're talking about mouths.
Yeah, we're talking about mouths.
Okay.
We're not talking about anything else. I mean, that's how you lose a license from the HPCSA. Yeah. You talk about stuff you shouldn't be talking about. Do you know what they do? They come to you and say, hey, who gave you that? Who gave you that?
Yeah, exactly. Okay, so we'll be talking about moms and mouths. Yeah. Okay, it sounded right in my head.
It's true. Moms and mouths.
Okay, so you're pregnant. You see it right there. It's a few weeks. Probably not a lot of changes you're experiencing, but within the second month, there will be some oral changes in there, and it usually peaks around the 8th month. You get gingivitis. It's because your estrogen and your progesterone like shoot up, and you'll get like
Swelling.
swelling.
Yeah.
Bleeding. Yeah.
There's this weird thing that you can sometimes get. It's called pregnancy epulas. Oh my gosh.
The
this,
words.
yeah.
It's been a while.
It's been a while.
What's the word?
Okay. Epulas, something like that.
Yeah.
Right. Anyway, it's like this weird swelling. And if you get that, don't worry, it's fine. It's just because of the changes in your body. Right. So I think those are the few changes. But I think a big change for me, and one that I've seen a lot, is like what happens after you get pregnant, right? And you see all these weird changes in the mouth, like an increase in cavities, an increase in teeth just breaking out of nowhere. And it's common. Like we have women who come in and they have so many cavities. And you're like, what happened? Like I just got pregnant. And it's true.
Yeah. Your saliva can be a little bit more acidic during pregnancy.
Reflux.
Acid reflux
Oh,
as
yeah.
well from the morning sickness.
Yeah.
A lot of snacking as well, because you do have a bigger appetite, which would lead to that.
So I think for me, the key thing I want to say is if you're going to become a mother or under the process of becoming a mother, congratulations, right? Beautiful. We need more babies, We need more. We do. We need more babies. And babies are cute. Like, have you picked up a baby?
It's been a while.
Oh man, I picked up a baby 4 weeks ago.
Mhm.
I felt this charge of like, wow. Like I felt happy. I felt this soft feeling on the inside, like, wow, human life. And she was like, I was like, wow. And she was so cute. And the eyes are like this big. Oh man, like
Sounds like you got baby fever there.
I got
I
baby
haven't
fever.
got any of those feelings.
Oh wow. Like I found it weird. Like I'm a grown man and I'm getting baby fever. Like the whole day I just thought about a baby. I just thought about babies. I looked at babies. I even Google searched cute babies on that day. Weird confession. Anyway,
Yeah. Under different circumstances, that would be like, why are you Googling cute dates? But like, because you gave the context,
yes, yes,
cool, cool,
yes.
cool.
So, but one of the things I can encourage you, right, is to start your journey with a dentist, oral hygienist, any dental practitioner when you start this process. Why? Well, remember those weird things we talked about, the gingivitis that you'll get, the weird swellings you'll get, and also you don't want to experience any weird, how do I put it? Pain when you get pregnant. I think pregnancy is a hard journey, and to have like a painful tooth in that can be a bit painful. Like imagine you've
Mhm.
got this and then you've got a painful tooth.
Exactly. I
Yeah.
think you're dealing with a lot already. You're dealing with the ankles, the back pain, the facial changes, the hormonal changes, the relationship with your partner growing, improving,
Mm-hmm.
growing. Yeah, finances being shifted around. The last thing you want to worry about is a toothache.
Mm-hmm.
And there's just also some this is its second trimester where it's just like really tricky to
Mm-hmm.
find the right treatment plan for you.
Mm-hmm.
Not that we can't treat it, but it's best to just not.
Mm-hmm.
So definitely do see a dentist because you might get gingivitis during your pregnancy, which is fine, but you never want it to progress to periodontitis, which is advanced gum disease, which will affect your bones and everything. Because the problem there is the inflammation isn't just limited to your mouth, it's all over your body. So there are risks involved. You could have preterm labor, you could have a stillbirth, you could get preeclampsia. Um, preeclampsia. And what was that other thing?
Hey
I
man,
mentioned prematurity, yeah?
I
And prematurity.
I remember teeth now.
Oh, yeah. No, we're sticking to teeth. I'm not talking about like the obs and gyne and stuff, but there is a risk involved if your teeth problem isn't fixed first. There's just a lot going on there. And we'll also talk about later how your perio can affect your endometriosis, but that's a different day. Today, we're just talking about moms.
Yes.
And with the cavities you'll be getting through your pregnancy, and you give birth and you kiss your kid, there is a transfer of bacteria which can cause early childhood caries. That in itself won't cause that, but there are a lot of factors. And if we don't introduce that bacteria in that baby's mouth that you would get from cavities, well, you would be protecting them in a way. So it's for you and it's for them. And you'll be saving up on a lot of also money in the future in 16 years when they're like, Mommy, I need braces. You kissed me when you had cavities and now I lost my teeth. So think about that.
Yeah, think about that. And what you said is spot on. Like you're dealing with so much. So the best thing I can encourage is for you to come, once you know you're pregnant, if it's been a while, just see your dentist, see if everything's okay. Make sure there's no teeth that are on the verge. And teeth on the verge are those teeth with cavities just waiting for that one day, one day, rubbing their hands. You know Birdman?
I do.
You know how Birdman does that hand rub?
Or like flies.
Oh yeah, yeah. Yeah.
Yeah.
So you're doing that Birdman rub, waiting you for to be 6 months in, and then boom, a toothache. And now it's not that we can't manage the toothache, we can't, but it always leaves us in this weird spot, and then
Like, yeah, I want to give you penicillin.
yeah,
I don't, but like I forgot my physiology. How is that gonna affect your kid again?
then you
Yeah.
call your GP friend, you're like,
Yeah.
is it safe to prescribe this? And then they're like, oh yeah, it's safe. So I'd say to prevent, I mean, sometimes you can't prevent it. Sometimes none of us sees it. But in cases where you can, I think it's better to see a dentist early on and also after your pregnancy journey, because remember you had all those changes in your body. You had the reflux, you had the change in your saliva. So your teeth might now start getting cavities. And this is not me trying to discourage you to have babies. Have babies. Like, have babies. The world needs more babies.
Mm.
The world needs
Winter's coming.
Winter's
Make
coming.
baby.
Make babies. But if you're going to make babies, just know, especially if you're a woman, it's on you. So make sure that, after your journey, if you can, try get to a dentist, and then see what's going on so that you can see any cavities that have formed from the reflux, any changes of any sort. So I would say that's my big advice to all the new mothers to be is see a dentist. And if you've given birth recently, see a dentist.
See a dentist.
See a dentist.
Yeah.
See a dentist.
Final tips on this one. New moms, don't let the baby sleep with the bottle on if they have teeth growing. Before they have teeth, it's all good. But like once they start getting teeth, don't let them sleep with the bottle of milk on. Another tip?
Yeah, don't let them sleep because, it affects the baby's teeth and the baby's teeth affect the adult's teeth. It's weird.
Yeah, it does. It's like a whole cycle. Yeah. So see a dentist, get some help. It can be really annoying, but we know how to take care of you. Good Lord, why does everything around pregnancy just sound creepy? Like, we know how to take care of you, ladies. It just sounds off, but like, definitely. Oh, another thing, nurturing as a mom, it starts with like while you're still pregnant, like the baby lives off you. They get what you eat, and when you aren't eating enough, they eat you. So like the nutrition that would otherwise go to you, is gonna go to the baby. So make sure that you're taking your vitamins, you're seeing your GP, eating well. Usually I think the cravings tell you what you're lacking. Like you might be craving milk because you lack calcium. Just do it. Work out still if you want to keep like healthy, but remember to eat well because you're eating for two.
Mm.
And then we'll see you afterwards and everything should be good. And we'll do this again next year.
Yeah, we'll do this again next year. And also, make more babies.
Wow, you have been preaching this, Elon Musk. Wow.
No, not like make more babies.
I don't know. He is preaching babies.
All I'm saying to my mother, if you become a grandmother. Wow. I'm joking. I didn't say this.
Your partner is watching this. She's like, what the hell? What are you?
Do I have a partner? What?
Oh, do you have?
Oh,
Are you single online?
no.
He's got a girlfriend.
Do I have a girlfriend? Are we gonna share that to the world? I'm joking. Yeah. I'm not expecting any children.
I mean, the business is still growing. How are you gonna pay for things?
Yeah, imagine
Yeah, I was visiting my friends, and they just got babies, so I was buying gifts for them. Spent like $2,000 on toys, 3 toys.
Wow.
3.
Do you know what's crazy? I once went to a baby store and then I bought a bowl for like $500. I was like, this is a bowl, but it just had a cowboy hat. And I was like, wow,
Babies are expensive.
babies are expensive. Wow.
Good luck to you, new mothers, and enjoy your Mother's Day. Enjoy, Nee.